A very good day, my dear postgraduate students and faculty. Welcome to SNIP, Short Notes in Pathology. And please do remember that serological markers for myocardial infarction is a university question for postgraduates. The importance of this picture is beyond description. And the final diagnosis depends on not only the clinical diagnosis as such, but also the other investigations. The entire panel is enclosed here with the ECG, the blood test, including the cardiac enzymes, echocardiogram, nuclear scan, radiograph, angiography, stress test, the computerized tomography, and MRI. A very good day, my dear postgraduate students. Welcome to SNIP, Short Notes in Pathology. And the serological markers for myocardial infarction is a university question for us. This picture is beyond description for all of us. And the final diagnosis in a case of myocardial infarction depends on the ECG, the blood test for the cardiac enzymes, echocardiogram, nuclear scan, chest radiograph, coronary angiography, exercise stress test, cardiac computerized tomography, and magnetic resonance imaging. To this can be added all the biomarkers, which are supposed to be highly specific and sensitive, and there is also a variation between them, which we shall be seeing. We should also remember that the pathologists are tomorrow's directors of laboratory, and these come within our domain. The ESR, the leukocytosis, C-reactive protein, etc. Now, these are the symptoms that are given over here. It can be the chest pain or the ECG changes or the various enzyme changes that are shown. And this incidentally is a panel of markers that are seen in a case of myocardial infarction, how they are increasing with the time and the severity of the disease. The cardiac enzymes itself is a very broad term. Please always do remember that if you prepare a question well, then your answer shall be excellent. It is a broad term, and there are several intracellular myocytic components which are responsible for it. And it is increased not only in a case of myocardial ischemia, but also any form of trauma or myocarditis. And in a proper setting, other things having been ruled out, it is a key to the diagnosis. And troponin now, all of you know, is the most common. But the others do exist, we'll have to see. And I am back after a heart attack, at least that is what the picture says. This kind of a graph, it will be nice if we draw, but at least do remember. There are the panel of enzymes over here, the myoglobin, its rise and fall, the total creatinine kinase, and also the creatinine kinase MB, lactate dehydrogenase and the various isoenzymes thereof, and the troponin. See the duration for which it can be relied upon. Some of them are extremely short, and some of them are within a very short duration there is a spike. These things are to be taken into consideration. What is the specimen that is required or a sample that is required? A heparinase serum. And there are several assays of the troponin, and the values greater than 99th percentile are taken. That is, it has to be as high normal or slightly above, even that is sensitively identified by it. And there are various assays which are used by different institutions. It has to be standardized. And these are all the modes of study. This panel I would like you people to kindly mention. Immunosorbent, electrophoresis, spectrophotometer, chromatography, immunochemical, immunoelectrophoresis, and the monoclonal antibodies. Kindly by heart this particular list. Troponin, we shall see the enzymes one by one. It is a regulatory protein within the muscle, and there is an interaction with the actin and the myosin contractile filaments within the cell. And there are two, cardiac troponin 1 and T. In the cardiac as well as the skeletal muscle, troponin T is also seen. Therefore, it is a relatively sensitive one and it is a newer assay with a wider range, highly reliable. And immunoassays are the modes, but there can be a false positivity due to cross-reactivity. This incidentally is a principle. Supposing an antigen is present, there is an antibody that detects it, in this case it is troponin, and then there is an enzyme that is linked to it, it will be having a substrate, and on linking you find it develops a color and it is studied by means of a procedure such as the ELISA. So there are two forms of it. One is the direct ELISA and two is the indirect ELISA. I would like you people to kindly go through it. In this one, I find that the enzyme is directly being attached. It has got a substrate and then there is a chromogen which is initiating the color which is measured. And this is of course the panel of reagents. And this is indirect, wherein there is a sandwich method. There is an antibody and then there is a target and then there is another antibody. So it is called a sandwich technique, and there can be the various techniques such as the biotin, etc. There is a chromogen that is attached, finally a color is being given. This is the basic principle that you people should know for any immunological investigation. The troponin assays. The older assays are within 3 to 4 hours of myocardial infarction. The peak is within 24 hours, and repeat evaluations are recommended for 2 to 6 hours to rule out whether it is coming down or being maintained. And cardiac enzyme of choice is troponin. It has got a high grade of specificity and sensitivity. False positive do occur in a case of damage to the skeletal muscle. So this is a quote that I picked up. I will never have a heart attack. I gave them one. I do not know whether it is the examiner or the student. Creatinine kinase, the second enzyme. So there can be false positivity in skeletal muscle injury. Please remember this. And it is a cytosolic protein, mitochondrial in origin. And there are 3 types of these isoenzymes, MB, and BB. That is what is shown over here. And the MB is supposed to be the mainstay before troponin, but after troponin, it has been pushed to the backyard. There is an increase in 12 hours, much later than the troponin, and it can be used to reassess any kind of an infarction or a reinfarction. And caution should be there in cases of muscle injury. See it over here, BB in a case of brain and lung, MB in a case predominantly cardiac muscle, and MM for skeletal muscle. These are all called the different types of isoenzymes. The conditions to be ruled out whenever there is an abnormality of these enzymes will be not only myocardial infarction, myopathies, rhabdomyolysis, muscular dystrophy, malignant hyperthermia, malignant syndrome, neuroepileptic, and then paralysis, drug-induced myopathies, renal damage, intramuscular injections, strenuous exercises, and so on. The entire list is again being repeated over here. Kindly go through them. I think it will fetch you good marks. Myoglobin was another enzyme. It was earlier the enzyme of choice before the creatinine kinase. Long duration is needed over here, and the myoglobin is used in conjunction with creatinine kinase MB. Both of them are used together to make a diagnosis. It is a very small heme protein and it is rapidly released. It has got a very short half-life and it has got a high sensitivity and it is released from the myocardial muscle. So these are the various enzymes over here. Different colors are given. You people can judge the time of release and the duration of stay. Heart type fatty acid binding protein. For heaven's sake, I admit I do not know this at all. It is not available in the USA. It is, one study says it is much more sensitive to troponin and myoglobin for the early myocardial infarction. However, you find that it has to be studied further. Copeptine, this is another one which you will have to mention, is the C-terminal end of arginine vasopressor. So these things we will mention in our answers. Lactate dehydrogenase is an age-old one that has been studied. And lactate dehydrogenase, you find that there are 5 different types of isoenzymes. This is a composition that is given. One is being present in the myocardium and the kidney, skeletal muscle, as well as the liver. These are all the things. Earlier it was used before the creatine kinase and the MB. No longer regularly used, and it is found in many tissues, therefore it is not highly specific. Second disadvantage is it takes several hours. So there are different types of isoenzymes. When you do an electrophoresis, you find that there is an increase of the various types of this lactate dehydrogenase, which is then blotted onto a paper, the zymogram. There can be interfering factors we have already mentioned, such as the renal disease. There can be cross-reactivity. Different assays will be needed, and myocardial damage, of course, is the mainstay. The main findings will be the critical findings. Other damage will have to be ruled out, and further workup will be needed. What are the various techniques? This again you people shall and will by heart. Immunosorbent assays, electrophoresis, spectrophotometer, column chromatography, immunochemical method, immunoelectrophoresis, monoclonal antibody. These are the things. The monoclonal antibody, of course, is the mainstay today with immunohistochemistry having come into force. So there is an antibody, there is an antigen, and then there is a coloring substrate. The diagnosis, there will be the salient features such as the ischemia, change in the ST or the T wave, or there is a new bundle branch block. Pathological Q waves can be present and imaging evidence that can be there, or there can be a new regional motion abnormality. Finally, there can be an angiography or finally a tautopsy. The dead are teaching the living. So this will be the markers over there, and then this is according to the European Society. This criteria has been framed. So this is again a myocardial infarction. Two things are important for us. There is a normal ECG or EKG. There is an elevation or abnormality in the T wave, and then there can be a depression of the Q wave. There are many other abnormalities. Kindly ask the cardiologist or the professor of medicine. Thanks to Cleveland Clinic. The significant markers will be those that decide the morbidity and mortality, those that are helpful in the early diagnosis, and there is a heavy burden on the cardiac enzymes. Along with that, there should be the signs of ischemia and the diagnosis of myocardial infarction. Dear heart attack, you picked the wrong person. I am still alive.